All right, welcome everybody. Good morning. Sorry about the few minutes delay. Let me introduce our first speaker of the day. Dr. Melissa Barbara has many activities and things I could highlight today, so I'll try to be as succinct as possible, but we're very excited to have her. She earned her doctorate in medicine and belongs to the Elam contingent of Cuba's Henry Reeve Medical Brigade. Fulfilling her passion to work in and for her community, she participates in a host of community projects, conferences, rallies, and protests that advocate for the rights of and well-being of fellow citizens. Dr. Barbara is a co-founding member of South Bronx Unite, SBU, a coalition fighting for the health, environmental, and economic justice for the South Bronx, is a board member and CFO of the First Community Land Trust in the South Bronx, the Mott Haven Port Morris Community Land Stewart Incorporated, is a founding member and co-organizer for the Bronx Parents Autism Support Circle. Many other activities that we could list. She's currently working at the Interreligious Foundation for Community Organization as the director for the Elam Medical Scholarship Program. Dr. Barbara developed the COVID-19 Community Pesquisa Project, which will study the effects of COVID-19 on a particular South Bronx community. She's presented her research, the Latin American School Medicine Scholarship creates opportunity for racial diversity in U.S. primary care workforce in the Cuban 2018 International Conference, Cuba Salud 2018. She has participated in several maternal infant conferences and workshops, including Innovative Approaches to Reduce Infant Mortality Symposium, in conjunction with the University of Illinois Chicago Cancer Institute. Catch my breath. So please, let's all welcome Dr. Barbara. Thank you.
Hi, thank you everybody. Can you hear me? Okay.
I'm going to share the PowerPoint now, Melissa, sorry.
Okay. Let's see. Okay, great. Okay, so today my talk is going to be about universal healthcare, Cuba's internationalism, and community organizing, and how that became a model of sustainability for Cuba in the time of its revolution up until present day, as well as how that same model became something that many of the grassroots organizations of the 1960s as well as present day continue to use effectively for healthcare reform and healthcare change within the United States. You can go ahead, James. So I want to start by just talking about the Cuban Revolution. So the Cuban Revolution began on January 1st, 1959. It took place as Cuba, former President Fidel Castro actually began to take over the country from the Batista regime, which was in rule at that time. And the actual interest of this new Cuban Revolution, which was so different, actually brought about a huge change because the country now had to deal with a lot of the crisis of what was happening in the nation with the poor. So at that particular point in time, there was no national identity. They were under a regime formally. They literally had the majority of the population that was illiterate. The healthcare system, it was basically an overlapping privatized system that really didn't have space for the poor, or if there was healthcare for the poor didn't know about it. And also just the housing situation that was happening, the food situation that was happening had to really undergo a significant change. So the primary focus of Cuba's revolution as Fidel began to take over the country was that they had to form this national self-determination. And that had to be Cubans working collectively in solidarity to actually move the government forward, not having a distinct identity, but having a uniform identity. So at this point, it was almost like the dream of Jose Marti, who's the national hero, to actually, say that Cubans, whether they're Black, mixed race, or white, would actually be in unity to actually move the country forward in its identity. They also had to come up with an educational plan to create literacy of the peasants and the poor that were actually living in Cuba at the time as well. They had to remodel the healthcare infrastructure of the country because with the revolution came these ideas of that everybody, every citizen as a human right would have access to education as well as healthcare. So, the idea of this universal healthcare model came into play, and they had to figure out how they were going to get access for everybody to be able to have these services at hand. And not in the sense of like a social welfare reform, but that these tenements of the revolution would be actual rights, human rights of the people in a dignified manner. So you can go ahead, James. So before the revolution, we talked about that. There was no, the overlapping medical system, a weak state-run healthcare system for the poor. There were shortages of doctors because many of the doctors had actually fled with the revolution. There was no rural medicine or access to medicine for those living in rural places within the island. There was no vaccination program. There was no pediatric care for children. So there were a lot of things that they actually had to come to terms with, with this new idea of the revolution coming into Cuba. You can go ahead. So the Cuba's principal revolutionary task at this point was to, one, reconstruct its healthcare system to provide a model of patient-centered care that focused on prevention of illness through routine care and checkups, as well as education. They created the Ministry of Health for Cuba. They had to reconstruct hospitals. They had to now, because there was such a severe shortage of hospitals, they had to increase the training of medical doctors and also medical research by recruiting the poor and the peasants. So these were people who didn't, previously had no education and had no access to education. So that now they had to undergo a system where they would be recruiting some of the poorest of the poor and people who had no education to actually fill in the gaps of the medical professional needs of the country. They also had to massively expand medical care to all of the rural areas that had no access to it. And they also had to do an extensive amount of health literacy through, public education campaigns. So this was one of some of the main primary tasks that the revolution was faced with, that they had to deal with as a country if they were going to move forward in the model and the vision that they had in their mind for Cuba as a sovereign nation under this new Cuban Revolution. Go ahead. So now we're going to talk a little bit about just the framework of preventive medicine and social medicine. Like, what does that mean exactly? Right, when we talk about, preventive medicine, we talk about social medicine, it means that this particular framework of medicine, this particular framework of healthcare has implemented several services that, one, actually make sure that the needs of the society are completely met, right? And it also will ensure that all residents, all, citizens of the country would actually have access to dignified care, not just any care, but dignified medical care, right? And so what did that entail, right? What does that entail when we talk about preventive medicine? It talks about how they had to literally create health literacy, right? If people don't know, what are some of the ailments, what are some of the medical conditions that affect them, how would they be able to, or why would they want to access healthcare? Right? If it's not known to them, what is it that they actually need or what conditions actually ail them, right, as a society. The next framework of the whole preventive social medicine this type of medicine actually has to assess the community and the community's health in real time, right? So what would they need to do to actually access or assess the community at hand, right? How do you assess the community's health? What are some of the steps that need to take place to actually do that? in order to assess the community's health, you need to actually know what's going on with the community. Who are the vulnerable people in that community, right? What are their day-to-day needs? What are some of the things that are ailing them? What are affecting them? How do you address those needs so that they can be well? Because we talk about wellness being the whole, right? The psychological aspect of a person, the biological aspect of a person, as well as the social environment of that person influences whether they're well or not. So how do we really create a situation where at all times we're mindful of what's going on in the community with all of the residents that are there, right? And then also just in the healthcare structure model, particularly for Cuba, they came up with a 3-tiered system, right? In the Cuban neighborhoods, the first primary tier was always a doctor-nurse team. So they decided that they would create within a 10-block radius, that each 10-block radius would have a doctor and nurse team that would take care of all of the issues within that community. Like in the morning, their clinic that was in the community, people could actually go for medical consultations in the morning and get all of their needs addressed at that particular clinic area. Then in the afternoon, the same doctor nurse team would actually be going door to door in the houses to actually assess what was going on in the house. What was the living situation of these residents? What were some of the things that were ailing them? And so they really were able to get a handle on what was happening at the hyper-local level to really understand what was going on with each citizen and each patient within that community. The second tier of the model was actually the polyclinic, right? So if there was a situation in which the doctor-nurse team couldn't handle because they needed more specialization, they would actually go to the polyclinic, and the polyclinic would have, you know, specialized doctors that did, you know, OBGYN, ears, nose, throat, you know, orthopedics, every other type of specialization that could not happen on a community level at that 10-block radius would actually be taken to the polyclinic. That's where all the labs were done if people needed to have labs or special imaging that needed to take place for whatever other ailments they might have had, they would go to the polyclinic level. Now, if there was a need that was beyond those first 2 tiers, now you would have the tertiary tier of the hospital system, which involved the hospital. And so patients would actually go to the hospitals that would take care of specific regions of Cuba, and whatever ailments that could not be handled on those first 2 tiers, they would actually go to the hospital and be treated under the guise of that hospital and the doctors, nurses, technicians, and everybody else that were in that hospital. You can go ahead. So when we talk about just having that framework of social medicine and preventive medicine, and just all of the ideas of what they wanted to do in the revolution, we can talk about just some of the achievements that the revolution actually brought about in Cuba. So when we mention like just medical education in Cuba and abroad, Cuba was able to make 13 medical schools, 25 medical faculties, 4 dental faculties, 1 nursing school, have 151 hospitals, 451 polyclinics. So those are the community clinics I talked about. And then we had over 12,000, close to 13,000 doctors on any given moment that would be in charge of those 10-block radiuses that we talked about throughout Cuba. And then they also decided that over time, they would have a system in place, what we'll talk about in a little bit, which was the medical internationalism, where they will also graduate health professionals in medicine, nursing, and health technology. And they would also create medical schools offshore. So they had medical schools now in Africa, Venezuela, and Haiti that would literally address some of the concerns of those nations in those specific nations. Keep going. A few of the other achievements that they accomplished during the early years of the revolution was also education literacy, right? So I talked about how when the beginning of the revolution took place, many of the people that were living in Cuba were illiterate. We had a lot of peasants, we had a lot of poor people, we had a lot of people in the rural mountains that didn't know how to read. And so in 1961, the goal of the Cuban government was that they would have the whole nation be able to read in that 1 year's time, right? And what they did is they actually got school-age children to go and disperse them throughout the regions throughout Cuba. And those school-age children would actually provide educational programming that they were armed with and teach all of those people that did not know how to read. And so within that 1 year's time, they literally brought the literacy rate up such that every person just about in Cuba would know how to read and knew how to read. And today they boast about 99.8% literacy rate. And there's a documentary called Maestra that you could actually read, look into, read, see, that actually documents the whole process of how the country was able to do that, right? In addition to like just some of the literary achievements that they were able to accomplish, there was the evasion of U.S. colonial rule. For the longest time, the U.S. had in its mind that they wanted Cuba to also be another colony, as they had previously done to Puerto Rico. So that was a struggle that continued to happen, and Cuba, believing that it had a right to be a sovereign nation and to rule itself and govern itself, has always evaded U.S. colonialism. In addition to that, the other achievement was the U.S. healthcare for all of its citizens that we talked about. Now some of the achievements that Cuba boasts about is the life expectancy, right? This is a developing nation, and as a developing nation, when it comes to life expectancy, its population has the same, if not better, life expectancy than most developing nations, right? So as you can see, men in the US have a life expectancy of 77, women 81. In Cuba, men have a life expectancy of 78 and women have a life expectancy of 82. So this is very uncommon when you think about a developing world being compared to a first world or a developed nation. In addition to that, through all of the achievements, the healthcare achievements, Cuba has been able to accomplish an infant mortality rate of 4.0. We always talk about, if you want to know how much government cares about its people, you want to always investigate how that government takes care of its women and children, right? And so at this point, I think the US hails at 7.2. Live births per 1,000 deaths. So they're still way, way higher than what Cuba has managed to achieve in terms of infant mortality. In 2015, Cuba achieved the zero mother-to-child transmission rate of HIV and syphilis that continues to be present today. Keep going, Ryan. One of the greatest achievements of the Cuban Revolution in the field of medicine is that Cuba also had to increase its ability to do medical research. And in addition to doing increasing that medical research, they've also developed biotechnical labs that have been able to create medicines that have been very innovative in helping Cuba itself and other developing nations combat a lot of the epidemics that they've seen, a lot of many of the diseases of poverty that have been seen in many of those nations. They have been able to create innovative technology that would help themselves as well as other nations to combat a lot of the diseases that are being seen. So we talk about the creation of CEMAVAX. That's a vaccine that blocks the growth of lung cancer tumors. They've been able to literally implement that vaccine since 2010 and actually use it within the population. Now that actual vaccine is in research clinical trials here in New York City. With one of our major research institutes. They created what's called Vitatox. Vitatox is a medicine made from spider venom, and that is medicine has been able to alleviate all of the side effects of radiation and chemotherapy. That has not been introduced into the US, but several of the patients who are very familiar with Cuba's innovation in that respect have been able to get some of that medicine over to here in the US and use that medicine. So many of doctors have actually been able to see how valuable that medicine is in decreasing the side effects of radiation and chemotherapy. In addition to that, they created Prop P. It's a treatment for diabetic foot ulcers. Since 2014, it has been registered in over 26 countries and used by 165,000 patients. The US Treasury Department has denied its future use or sale in the US. And I'm sure you can imagine why, because diabetes is one of the top medical conditions that ails people here in the States. So pharmaceutical companies would definitely lose a lot of money if we were able to get a drug of this nature to the US. We've also been able to boast about like the rate of infection of HIV and AIDS in Cuba being decreased just because of the level of screening, the level of educational campaigns that go out for disease. In addition to that, Cuba has the most antiretroviral therapy coverage amongst people with advanced HIV infection. You can go ahead, Brian. And some of the other just the ability and achievements we'll talk about a little bit later on as well. But what I want to transition into is with the Cuban Revolution, we have a lot of models in which Cuba has prided itself on, or principles, I should say, not models, but principles, right? And one of the things with the revolution, Cuba has always considered itself a nation that prides itself on internationalism. And internationalism meaning that they decided a long time ago in developing their revolution that they would always be their sister and brother nation's keeper, right? So if they saw that their brother or sister nation needed anything, that they would actually be a helping hand to help those nations in whatever that case would be, whether it would be political, economic, or just in health cooperation. So they had this constitutional belief and they always said that they would do that. And, you know, what was important? Some people are like, oh, you know, Cuba does all of this stuff, but what do they gain from being a country that roots itself in internationalism? So there's, you know, several importances to that idea of internationalism. First, it's a moral and ethical code that they can stick by and stand by as a nation. But just also, in addition to that, because Cuba has a blockade that has been imposed on it, or an embargo that has been imposed on it by the United States, it was one of the ways in which they could counteract the US's isolation of Cuba from the world, right? So this is a way in which they can bring attention to all of their revolutionary ideas. This is a way in which they can still exchange with other countries and other nations of the world to make sure that they wouldn't be completely blocked off. It also diminished US capacity to assault Cuba militarily, because if the world is watching and seeing all these great things happening outside of Cuba, for example, like we see with COVID-19, right? The US is less likely going to be able to, you know, do a full-scale attack on a country that's actually doing good for the world, right? And so these were some of the ways in which the Cuban internationalism began to play into the idea of not just the society, Cuban society as a moral code or ethical code, but it also began to allow them to branch out to other nations in the world so that they wouldn't be completely cut off. You can go ahead, Barry. So what does Cuban internationalism look like in reference to the beginning of its revolution and now? So we talked about in the early 1960s how Cuba had to do so much to revitalize its country. Keep going, Ryan. And so in some of the earliest forms of Cuban internationalism, what we saw was different conferences, different ways and strategies in which Cuba actually provided that internationalism. So the Tricontinental Conference of January 1966, what it did is actually brought a lot of social movements and people from all over the world to come to Cuba. And the idea behind this actual movement was that Cuba could get all of these different movements to actually commit to be a part of the revolutionary idea of creating social medicine and social change within the world. They would also be able to use this conference to make sure that they were propagating their idea of revolution and what that looked like to other spaces in the world. In addition to that, in the early, beginnings of the revolution, Cuba began to send aid to anti-colonial movements, for example, in Angola and Namibia. Cuba, in the form of their medical doctors and their military, would actually do military intervention that contributed to the fall of apartheid in South Africa. They later on in 1986, they completely treated the victims of the Chernobyl nuclear disaster. In the early beginnings of their revolution, they began to create or provide a space for political asylum for people that they considered prisoners of war and that they thought were being persecuted by their respective nations. Cuba and its internationalism also began to do huge medical collaborations. So they literally got to a place where over 400,000 Cuban health professionals have completed medical missions in 164 different nations of the world up until this point. Keep going. They created, in some of their research studies, they were able to do genetic and psychosocial studies of over 1 million individuals with disabilities in 6 different ALBA members countries. They created vaccination programs for many of the developing countries that didn't have it. Operation Milagro was a campaign that they actually did fighting blindness. So many people in a lot of the developing nations, as well as Latin America and the Caribbean, were affected by cataracts. And so what Cuba began to do is they began to conduct eye surgery so that these people who had cataracts would be able to see again, right? Cuba also began to help to control a lot of the epidemics that were taking place by creating vaccines, by providing medicines to many of these countries that needed it at the time. More recently, Cuba's internationalism looked like the school that it created, which is one of the biggest, largest international medical centers in the world, called ULAM, which is translated the Latin American School of Medicine. In addition to that, they created the Reeve Medical Brigade, which is an international medical brigade that does disaster mitigation and lends its aid to many nations throughout the world that are going and undergoing disaster, as well as epidemics or pandemics. They created medicines, which I spoke to you guys about. I did mention Semavax, Herbapod, and Vitatox, but one of the other medicines that they have created was an interferon alpha-2b recombinant, which has been very successful in helping to control the COVID-19 pandemic throughout the world. And then also just in terms of the more recent internationalism that we see of Cuba is COVID-19 and its response to the world. Right. Okay, so what I did right here when I talked about internationalism, I talked about it in these 3 countries, Brazil, Ecuador, and Bolivia, just because I know recently in the news, if you keep up with the news, these 3 countries actually kicked many of the medical doctors out of the country and charged that they were, medical terrorists, or they were doing some kind of espionage. And a lot of that came about because of the US intervention and wanting to really sabotage the medical collaborations that Cuba had with these countries, because it was a way in which they could shut down the production of money to those countries, as well as the collaborations that was taking place. So I wanted to highlight these three countries and just let you see how Cuba's internationalism were able to really help these countries in providing care. So Cuba came up with a strategy called Mas Medicos, and that was a program from August 2013 to November 2018. That program allowed 359,000 patients to be actually seen and treated by Cuban health professionals throughout the 3,600 municipals throughout Brazil. Because of that program, 60,000 Brazilians were able to obtain permanent medical coverage. And then as they were, because the countries, or specifically Brazil in this case, actually expelled many of the medical doctors, as they saw the rise in COVID, the same Brazilian government who called for the expulsion of these doctors literally begged for the doctors to actually come back and to help them during the COVID-19 crisis. So I also wanted to talk about, like I said, just the same with Brazil. I wanted to talk about Ecuador and Bolivia because we saw those two examples of those countries expelling Cuban doctors. So just wanted to make clear that 3,565,000 Cuban health professionals provided services to this nation from May 2019 to present. In that, you can see the numbers: 6,749,666 medical consultations took place from these doctors. They were able to do 212,360 surgical interventions. Many of those were in specialized surgeries. Over 3,500 births were performed by these specialists. The country was actually given over 100,000 doses of vaccines. 153 ophthalmologists performed 168,543 eye surgeries through the Operation Milagro program that I just mentioned. 35,257 patients received specialized services in neurophysiology and ears, nose, throat. 21,000 patients received genetic counseling, right? In Bolivia, you can see a lot of those numbers being some of the same as well. 406 doctors actually provided services. Of those doctors, 32 were specialists. You can see that over 73 million medical consultations took place. Over 1 million surgical interventions were performed. Over 60,000 births were performed. 22,221 vaccines were given to the nation of Bolivia, and over 508,000 eye surgeries were performed as well. And these are I just mentioned these particular cases and countries, but Cuba has done this for many other countries throughout Latin America, Africa, and the Caribbean. Go ahead, Ryan. So I wanted to show you in the form of just Cuban international medical internationalism. You can also see that one of its top biolabs called Labioform were actually able to help in the control of several epidemics throughout the world from the early 2000s on. You can go ahead. And as I said, one of the main versions in which we see that medical internationalism by Cuba is through ELAM, which is the Latin American School of Medicine. This school was actually created in November 15th, 1999. And it was actually the result and the product of two hurricanes that actually hit the Caribbean and affected Haiti, Dominican Republic, and several other countries. And during that time, Cuba actually sent a brigade of medical doctors to actually restore some of the infrastructure after those hurricanes. And what many of the doctors, usually when they do medical brigades, the brigades stay for about 6 months. And what Cuba saw is that in many of these countries, they were there, and they were the only and sole people that were providing the health care to the citizens. So there was no healthcare infrastructure after those hurricanes that hit. And so many of the doctors who were there literally began to talk to the government, Fidel and his think tank, and say, you know, when we leave, there's nobody else to administer healthcare to the people in the most rural places where we are. So what's going to happen to these people? And Fidel and his think tank got together and they said, you know what? We can actually create a school, and we'll create a school and in one of our old naval academies. So this was a restructured naval academy. And he said, what we'll do is we'll grant scholarships to students from some of the poorest of poor nations, and we'll educate them to be the doctors that are needed within their country.
What's up? Dump truck? Yeah, dump truck too, right?
Hi. Somebody needs to put themselves on mute. And so what began to happen is in that short period of time, Cuba actually created ELAM and from the formal naval base. And what they did in the beginning is they created a system where they would give 500 scholarships to the first few countries that were actually affected by Hurricane Mitch and Hurricane George. And then they began to grow. So for the next 10 years, they actually invited several countries and began to give 500 scholarships to each of those countries for that 10-year period of time for free. And then the stipulation of those scholarships were that those students would then go back to their home country and provide medical care to all of the municipals and all of the departments within their healthcare system, so that the poorest of the poor would always have access to healthcare. You can keep going. So one of the phrases that I love to actually mention when I give talks about ELAM is one of the quotes of Cuban former President Fidel Castro. And he said, what we want from the Latin American School of Medicine is for students from our sister nations to become imbued with the same doctrine in which our own doctors are educated, with that total devotion to their noble future profession. For a doctor is like a shepherd, a priest, a missionary, a crusader for the people's health and physical and mental well-being. One of the reasons why I put that up, and I think is very important, because it also reflects just the idea that with the idea of being a revolutionary person or a revolutionary doctor, that you would also have as a signature in that to literally make sure that you're a servant that is always serving the people and serving the community. Right? You can go ahead, Valerie. Okay, so one of the wonderful things about ELAM, as I said, it was founded in 1999, but over the 20 years, it just recently had its 20th anniversary. And over that 20 years, there were 30,000 students from 124 nations that have graduated as doctors and have gone back to their respective nations to practice medicine. Some, almost 7,000 graduates have earned advanced degrees in comprehensive general medicine. Comprehensive general medicine is what we call the equivalent to family medicine residencies. And over 2,000 of those doctors have also gone on to do advanced specialties. I highlighted, like I said, Brazil and Ecuador and Bolivia, because I just wanted to let you guys know that in addition to being in the medical collaborations with those nations, Cuba also educated 1,214 Brazilian students that graduated from ELAM, 2,093 Ecuadorian students, 5,184 Bolivian students. And also, this might surprise you, but this program has also provided scholarships and continues to provide scholarships for poor students within the United States. And we have graduated over 196 students that have become doctors and have come back to practice in mainly primary healthcare fields within the United States. present day. So those are the statistics as of late July 28, 2020, for U.S. students that have graduated from the medical school. We currently have 70 students that are actually practicing medicine at Elan in various levels of their medical school career. So one of the wonderful things that I'm sure many of you have heard about, if you haven't heard about it, you'll hear about it now, is the Reeve International Medical Brigade. And when you hear about many of the medical doctors that are being sent after natural disaster situations, you will hear about the Reeve Brigade, because that actually was what the brigade was designed for. So the Reeve International Medical Brigade consists of a group of doctors, nurses, medical professionals, techs that are highly prepared and are experienced in epidemic and natural disasters. So these are the people that are deployed when you hear about natural disasters in the world and people need help. Cuba actually sends members of this brigade to help those countries. The Reeve Medical Brigade actually was formed in response to Hurricane Katrina. Cuba actually prepared 250 doctors to go to New Orleans, Louisiana after Hurricane Katrina to provide medical services to the citizens in New Orleans. But the Cuban doctors were rejected by the U.S. government. That President Bush Jr. was actually the president at that time. And the unfortunate thing about that rejection of those doctors was that it left thousands of people in New Orleans without medical care, medical attention, and the dispersion of many of those people throughout the U.S. Still kind of dispersed, and not all of them being able to still go back home to New Orleans at this point. This particular brigade, the V Brigade, also has just been amazing in that it's completed 28 different missions throughout the world. When the first group of missions doctors were rejected, so those 250 doctors that were actually rejected by President Bush to go to New Orleans, shortly thereafter, there was a mudslide in Pakistan. So they all translated to Pakistan and began to do work in Pakistan right shortly after. In October 2014, the brigade actually traveled to West Africa to fight the Ebola crisis. And also you heard about this same brigade, which I was also a part of, that did a lot of the initial healthcare framework and building back up of Haiti after the 2010 earthquake, and also in the fight of cholera in Haiti. So that's a picture. Keep going. So COVID-19 pandemic and Cuba's response to that, right? So how has Cuba responded? What have they done? How has their response been different, of course, than our response here in the U.S. and many places within the world? So one of the things, keep going, Ryan. So at the beginning of COVID-19 in Cuba, one of the wonderful things about the Cuban healthcare system, because it is based in social medicine, they always have a very close look at what's going on in the community. So they've always been able to assess what's going on in the community in real time. And one of the ways in this particular case why that was helpful is because in March 2019, they had 10 confirmed cases of COVID-19 that they traced to 2 Italian tourists that were actually in the nation. And they were able to control those because once they literally traced those cases, they began to actually do what we call pesquisaje or pesquisa, which is like a screening of those surrounding areas where the tourists were, to make sure that every case that was exposed would have access to treatment, would have quarantine, and would be at a place where they wouldn't spread COVID to other members of the community. So In addition to that, in addition to that time frame or that period of time, also, I'm sure you all, if you paid attention to the news, you saw that there was a MS Bremar transatlantic cruise ship that was actually stranded and looking for a place to dock. That cruise ship actually had 5 confirmed cases of COVID on it, and many of the ship's crew were also isolated in quarantine for having flu-like symptoms. Britain actually contacted the U.S. and Cuba, both nations, to see if the cruise ship could actually dock in the ports, and the U.S. actually rejected them and said that they couldn't dock in our ports. But Cuba, even saying that they had cases, offered members treatment and said that they could actually be treated in the hospitals within Cuba. And they also were able to isolate the 5 passengers and take them to one of the designated centers for COVID positive patients. Those patients who were too weak to travel actually stayed in Cuba and were actually treated, and all of them were actually brought back to health. So in addition to that, in the beginning, Cuba, seeing the crisis of COVID, also began to boost the production of the interferon alpha 2B, a recombinant antiviral drug. They had produced this drug in with the collaboration of China, and have been working on a drug with China and providing it as a drug that would be part of many of the protocols for COVID-19 treatment. So what they began to do is massively produce that drug. As they begin to run out, unfortunately, Trump decided that he would actually harshen a lot of the trade agreements during the same time. So it actually prevented Cuba from getting some of the materials necessary to actually continue to make some of the drugs that it was actually shipping to many of the nations that were dealing with the COVID-19 crisis and trying to diminish their numbers. And so countries like China began to actually send aid and send some of the materials that were necessary to continue to mass produce the vaccine and get it to many of the countries and nations that needed it at the time. In addition to that, Cuba began to also just prepare its civilian and military hospitals, and they began to designate hospitals as specific positive COVID-19 centers. And once a patient was considered positive, they would actually be brought to those specific centers as opposed to treated in regular society. Sometimes we had cases where people would go to their regular hospitals that weren't necessarily designated as COVID-19 centers. So each hospital also in Cuba had put in protocols in place that they would actually be able to receive patients that were positive or had been exposed to COVID-19. Cuba also, because of its system, it has that all hands on deck approach to screening citizens within the country by utilizing health professionals, medical students, community organizers. And that's literally how they begin to do their screening process. So all of these workers, all of these students begin to knock on doors, going door to door every single day and doing rounds to make sure that nobody had flu-like symptoms, fever, respiratory ailments, or had any exposure to COVID-19, people who were positive with COVID-19. And that's how we were able to keep many of the cases and the number of cases down within the community and within the nation of Cuba. In addition to that, Cuba also began to prepare its medical brigades and send many of those revolutionary doctors with medicines to combat the virus in places like China, Northern Italy, Suriname, Nicaragua, Venezuela, Jamaica, Grenada, and Spain. So right now, I actually In addition to that, I wanted to talk about a little bit of the strategy that Cuba had at this particular time. One was that they did a border restriction. So at this point, they shut down all their borders, and they were like, there's no tourists that are going to be allowed into the country. And they had literally come up and devise a plan where that within a couple of weeks' time, all of the tourists that were in the nation of Cuba could actually make plans to go home. So that there would be no spreading of disease, and patients would, tourists from other countries would not get sick within the country of Cuba. There was a mandatory 2-week quarantine for persons entering the country. Any people that had exposure to any other person with COVID-19 would actually be having to do mandatory quarantine. That quarantine could actually take place either at home, depending on who you live with, or it could take place at one of the designated hotels that was created to be an isolation place or isolation spot for COVID-19 patients. They suspended internal travel throughout the island. They locked down all of the institutional buildings and work, just like we did here, and everything literally translated into remote working and doing everything remotely, if possible. They suspended all recreational activities that involve more than 3 people. So if you had more than 3 people together, that activity could not take place. Like I said, they designated hospitals for specific care, and they urged people not to go to their regular hospitals, but to go to hospitals that were specific for COVID-19. But then if like patients had urgent needs and they really needed to go to the hospital that was in their specific area, there were designated protocols for that to happen too. They differentiated treatment protocols for the elderly and handicapped. They increased food production as well, and they made sure that all of the elderly, the handicapped had access to the food and everything that they needed while they were on lockdown. I think this next slide, I put it for, you can go ahead, James. This next slide, I wanted to show you one video that talks about or that shows the Cuban pesquisaje model so that you could actually see it uphand. And then afterwards, we're going to hear an account from one of the students that actually talks about the pesquisaje and what they actually did.
In the fight against COVID-19 starts off first and foremost with an emphasis on prevention, and that's preventing the virus from entering the country, and then preventing the virus from entering certain neighborhoods. In areas where there are positive cases of COVID-19, the goal is to contain the virus. And all of this is done with the participation of sectors from every aspect of life, from doctors, from medical students, other healthcare workers, and more importantly, members of the community.
Cuba's approach to fighting COVID-19 is a proactive, which makes sense because the healthcare system is founded upon preventative medicine. When the pandemic really started to take shape, Cuba did a great job of preparing their citizens on what to expect from the coronavirus, what are the signs and symptoms, what do you do in the event that get these signs and symptoms, who is the at-risk population.
The Cuban system is vigilant in that medical professionals actively look for cases rather than waiting for patients to come to them. In Cuba, the pesquisaje is used as one of the first lines of defense in prevention. Cuban medical professionals visit all the houses in their assigned communities in order to check up on their community members. It is used as a tool in order to prevent and control the spread of certain diseases, as well as a tool to collect biostatistical data.
We go into the communities, to people's homes, to see how is their home environment, how is their house, how is the community itself and the hygiene of the community, as well as other issues.
It's really important to identify potential cases in the community. That's the main objective of the pesquisa, but it's also a great way to remind the community about preventative measures and actions to take to fight COVID-19. We come here to the communities, we talk to upwards of 50 patients a day in their households, and we ask them who lives there, if there are any patients that are showing symptoms,
if there's any patients that are over 60, which is considered a risk factor, and therefore we add those numbers up and then we give them to the professor to then tabulate all this information and have it available for the people in the polyclinic to follow up on.
For me, I've been going to the same neighborhood, the same block, for maybe more than a month. So around now, I know the names and faces of like 60 plus homes. And they also know my face, but I don't go the next day. They ask me, where have I been? For me, that's what community health looks like, is where you get to know your patients.
Before now, we have done pesquisa yearly for dengue during its peak times. I feel as though during pesquisa is my way of contributing to assist in saving lives as a future doctor in training.
When the first case was discovered later on in March, Cuba readily made available the resources necessary to isolate and treat confirmed cases, recognize and quarantine suspected individuals, and conduct tests to diagnose or rule out suspected cases. The preventative measures have been active and not passive. That is because the cases are sought out. Within communities with confirmed cases, there are mass screenings and testings conducted.
When you get tested, if your test comes back positive, you are going directly to the hospital. You are ingressed, and you are going to a specific hospital attending to all COVID-19 patients.
A couple of differences between the Cuban approach and the American approach to fighting COVID-19 is one that Cuba has a central and universal healthcare system. Whereas in the United States of America, we do not have a universal healthcare system, or we do not have a healthcare system at all. And one of the advantages to that is that everybody on this island gets care, irrespective of income, race, et cetera, or any other determining factors. If you are symptomatic, that is known to be a risk for the entire country, and therefore you receive treatment. So what you are hearing right now is the applause that every night at 9 p.m., Cuban people everywhere, all across the country, go out on their balconies and windows and show their appreciation for all the healthcare workers in the country who are really sacrificing and putting themselves and their families at risk to try to eradicate this virus on the island.
Cuba has shown its solidarity with the world by sending its physicians abroad to aid in the fight of this pandemic. Some of the countries that have benefited from this aid are China, Italy, Jamaica, Togo, Mexico, amongst many. Even the UK benefited from Cuba's aid when it accepted to receive and treat infected UK citizens.
Elam teaches you to be ready for anything, and Elam teaches you to go where you are sent, to go where the crisis is, to go where the need is.
It has also stressed the importance of having a plan, having preventative measures, and also the importance of having collaborators, both domestic and international. In this case, it is one world, one fight.
It is amazing to be a part of a nation right now that has a human-centered approach, not because it's new to this pandemic situation, but because that is the structure of the Cuban healthcare system, to value people, to value humans, and it's not a business.
This really places into perspective the importance of having a system in place for when the next crisis hits.
It's an honor to live and learn in this system. I hope our communities back home will learn from this example and actively seek out the health of present and future generations. And it is clear that as COVID-19 respects no color or creed, our health system and society in general must learn to value all human life, regardless of color.
That's good. Okay. I will stop the share there. Melissa, we're going to go to the audio
You
file.
can go, you can go to the audio file, the first one. We're not going to do the second one because time is running.
So the one that's the Cuba's approach
Yes.
file, is that correct? Okay, let me share that.
Hello, my name is Jaywa Weathers. I am a sixth-year medical student here in Havana, Cuba. I'm originally from Newark, New Jersey, and I'm just going to give some information on Cuba's approach to fighting COVID-19 from my experience. I currently, because I am an intern, I'm currently still working, even though school has been suspended. So the first cases that presented in Cuba were cases that were coming into the country. And so during the time that we actually had a patient come to our hospital, I was actually at the Peds Hospital, William Soler. And so at this point in time, there were no real protocols put in place. But from that moment on, things happened very, very quickly. So initially, the idea is to centralize all suspected cases. And so what that meant was that all suspected cases were instructed to go to one or two hospitals. At this point in time, it was the infectious disease hospital and then the naval hospital. And so all suspected cases were sent there. However, that doesn't mean that all suspected cases will directly go there, even though there was an announcement made and the population was aware, you still had people who were coming to their hospitals in their area with cases. And so what that meant is that all hospitals then had to enforce a protocol in order to protect their population as well as their medical workers. So what people were doing at William Soler was that each entrance, first of all, they reduced the amount of entrances that people could use. That included for medical staff as well as patients. In addition to that, each entrance was manned by a security guard, which normally there's always a security guard at the entrances. But in this case, each entrance had a security guard who had a Clorox solution that people were required to use to wash their hands upon entering and leaving. This also was put in place by some of the restaurants that were still open during that time, where if you came and wanted to sit or even go into the restaurant, you were required to wash your hands with this Clorox solution. In addition to that, all medical staff were required to wear a cloth mask or a surgical mask. And if you had a shift in the emergency room, you were required to wear protective gear, which included a gown, a hat, and the mask. In addition to that, they also separated their emergency room, meaning they literally, on one side, you had suspected respiratory cases. And then on the other side, you had everything else. It was a responsibility of us as interns, as well as a nurse, to direct patients as far as where to go. Because there was one team that specifically addressed all respiratory cases, and then, i.e. suspected cases for COVID-19, in addition to another staff that was specifically for anything else. So upon entering, you had to ask the most important question is, have you come in contact with anyone that has tested positive for COVID-19 or has traveled and is suspected of being positive for COVID-19? And so that was the case. They were sent to one specific side. By the time that I started at Hospital Nacional and began my internal medicine rotation, a similar thing had been put in place. At this point in time, this is within 2 weeks. At this point in time, the country had closed their borders and had put a halt on all transportation, especially going from provincias, going from one provincia to another. That was stopped. School and work had been closed, and people were required to self-isolate at home. All suspected cases, again, were still being sent to a specific hospital. And so what that meant is if you came into our hospital, for instance, which is not a designated hospital for COVID-19, and you were found to be a suspected case, you were directly sent to one of the respective hospitals dealing with coronavirus cases, with COVID cases. So that was in place. And the other thing that I can talk about is their approach, what happens when you have a case or when you're suspected to be positive. Because my first week of...
It seems like it ends there, Melissa.
Yeah, it ends there. So I would love for you guys to hear the second half of that, but because of time, I'm going to cut that short. And
there was a comment that came earlier from Cheryl Billingsley. I don't know if you saw that in the chat, but she said that her country, SVG, is a recipient of Cuba's generosity in terms of healthcare, especially in eye surgeries, scholarships and the training of many of our young people to the medical profession as doctors and nurses. Also, we have one of the best renowned international airport as results of Cuba's contribution to her country. So she's got experience there.
So she can corroborate with my story.
Absolutely.
Any other person has questions? Don't be shy, don't bite.
Elizabeth Morales, I can ask you to unmute.
Okay.
Hi, good afternoon. Thank you. This is a wonderful presentation. And I wanted to ask, you mentioned that Bush had rejected the aid that they were extending to the people that were affected by Katrina. What was the reason? Because of the embargo? Like it goes into that, or was it like any other specific reason? And then the second part was, did Cuba, when the outbreak began, is there any documentation or that you have found where they again send their aid and it was rejected?
So right now, so to your first question, yes, it had a lot to do with the embargo that Cuba has experienced from the U.S. I think for so long, when it comes to the offering of Cuban doctors or medical personnel, or even medications, because of that history and that tension between the U.S. Having placed an embargo on Cuba, it has always been kind of we have always been a nation that has turned our noses up at Cuba and like, oh, we don't need your help, we don't need this. And unfortunately, what happens is that the people suffer, right? Because as we saw with Katrina, there was no help coming for any of the Black and brown people in that community, in that poor community. Again, with the COVID-19 response, Cuba offered to send interferon alpha 2B to the US as one of the medications and as one of the protocols of many of the medications that have been used. And I don't know if you know what the interferon alpha 2B is, but it's like an immunomodulator. It's one of those drugs that is a part of the family class of like cytokines. And it also, an interferon we have in our bodies, and what it does, it actually interferes with the replication and the division of an actual cancer cell or a virus. And so what they've seen as it's been added to many of the protocols, treatment protocols, it has literally stopped the ability of this COVID-19 virus of replicating. And so Cuba did offer, there's campaigns that you can go on. There's a lot of solidarity campaigns, a lot of the movements that have solidarity with Cuba, who is doing a huge campaign right now to actually get interferon introduced into the US as one of the protocols that we can use for COVID-19 treatment. And so that's been a working battle to actually get that process underway. But many of the solidarity groups with Cuba have been pushing a lot of the congressional folks, council folks, their assembly people to have the US government to actually implement that treatment as part of its protocols for COVID-19 care.
Great. We have a couple questions in the chat, so I'll read from there, Melissa, if that's okay. Jennifer Dykes is wondering how you and other U.S. students became aware of the ELAM program and whether you faced any legal difficulties getting U.S. permission to go and practice when you came back.
Literally the program has, like I said, it has been offered since 2000 here, 2001 for US students. And when Fidel actually came to speak at Riverside Church in New York City on a visit to the UN, he actually promoted the scholarship program. For a time, it was about maybe a couple of months between the time of promotion and saying, okay, we want to do this, we can offer scholarships to US students, because he understood after having conversations with the CDC that many of the opportunities did not exist here for Black and brown folk to actually access medical education here, and that the cost was so inhibitive. And so what he did is he asked, after the CDC knew about this, and he was like, okay, are you guys going to pick this up? Who's going to implement the scholarship? Many of them kind of stood back and said, we're not going to touch it because of the tensions between US and Cuba. And so a longtime solidarity group, IFCO Pastors for Peace, that's located here in Harlem, who's been doing solidarity with Cuba for over 30 plus years, Fidel had asked the executive director of IFCO Pastors for Peace if IFCO would actually be a facilitating body for the scholarship program. And they said, yes, of course, we would do it. And so from that point on, they actually gathered a group of medical advisory committee members that were medical professionals that could implement an application process for the scholarship. And they began to do that whole process of facilitating the scholarship for US students to go down to Cuba. That began in 2000, and we've been doing it ever since. I actually, as you heard Peter say in the beginning, I actually now run that program. So in terms of the transition, most students who are actually studying in Cuba right now would be considered what we call IMGs, which is called International Medical Graduates. And for any international medical graduate, just like US students, you would have to do the US licensing exams to come back to the US to practice here and to apply for residencies here. There is sometimes some difficulty because a lot of like snobby schools kind of say, oh, well, you're an international medical graduate, we don't accept international medical graduates. But for the most part, most people are very well aware of the Cuban healthcare system and how well-trained doctors are. So our program is pretty well known now within the circles of most medical hospital settings. And the training of Cuban doctors, because it's so well known, our students don't have as much of a difficulty as we had in the beginning years of getting into US residencies here. So our match rates for the last, I would say 7 or 8 years have been over 87% in US medical schools. At one point in the beginning, like I said, about 2000, I want to say 2002, 2003, President Bush actually threatened to shut our program down and ordered all US citizens out of Cuba at that point. Once again, foolishness. But we were able to set up full-scale campaigns and strategies to actually reach all of our congressional caucus members and congressional members and get them to lobby around us. And they were like, you are not going to destroy this opportunity for students of color to be able to practice medicine, or poor students to practice medicine here in our community, since we lack primary care doctors that can actually do this work. And so at that point, we got permission to actually be one of the only programs to study medicine in Cuba under a license from the US government. So we've always been kind of protected and shielded after that. And so our students have no legal difficulties in traveling back and forth to the island, as well as coming back to the States to practice here.
That's fantastic. Yeah, and I mean, my wife is a physician, so we've been through that process to some extent, and it's harrowing. An 87% match rate is amazing. Right. And, the thing, many American students end up going to medical school abroad, but it's even more prohibitively expensive for most of them than it would be, going to school in the United States. It's amazing. This is really kind of the only program that would make it possible for, students of lower socioeconomic status to go to medical school abroad. And on top of that, they're getting a training that's, you know, in a lot of ways better than what they might get in like the canyons, you know?
Yeah, right. So it actually prepares them for urban community settings. Like one of the doctors that you heard in the video, he's like, Cuba prepares you for everything. So whether you're in the back mountains of whatever country with very little resources to a developing country like the United States, you're very well prepared in your medical training to be here and practice anywhere and everywhere. And in addition, you know, for any of you who are on this line, if you know students, you know, who are from, you know, poor backgrounds, and now we've kind of opened it up. So we were not so restrictive about like just financial guidelines and stuff, who can apply to the program. But I can probably send Peter or somebody my information. But you can always contact me, because any student that you would know who wants a medical school education and finds it very difficult to access medicine here can actually apply to our program. We're in the middle of a cycle now that hasn't closed yet. So it's always an opportunity that's available to students throughout the US to apply for medical school.
Wonderful. We have one more question from Elga Lahoz. She asks, does the Latin American School of Medicine have any sponsors besides the Cuban government? Is it 100% funded by the Cuban government?
It's 100% funded by the Cuban government. Right now, what the program has, it's actually changed over time. When it first began and started, it was a program that was fully and completely funded by the Cuban government. And many delegations, we call delegations students from different nations. So the US delegation, some delegations from Costa Rica, some delegations from a few other countries are still on full scholarship. And then many other countries, what they do is they do an intergovernmental agreement with Cuba. So the actual country will pay for their students to come to Cuba to study medicine. But it's still kind of a scholarship means, because the students don't actually pay out of pocket. Their governments pay for them to actually study at the medical school.
Makes sense. Okay, we have a question here from Katharina Kempf. Could you talk more about the cultural norms that allow for the success of community-based medicine in Cuba? She asked because a culture of individualism is often named as a challenge in responding to the COVID-19 pandemic in the United States.
I think, like I mentioned in the beginning, one of the interesting things about Cuba is that from very early on in the revolution, that national identity became a really big thing, right? So it became the idea that we're not a nation for capitalism, but we're a nation built on socialist ideas, which means that as a nation we'll move forward addressing and thinking about, clearly thinking about, or intentionally thinking about the needs of society and meeting those needs. And so like the socialist system was really designed so that everybody's needs, especially the basic needs, could be met under the confines of that system. And then in addition to that, having this national identity that really allow them to always move forward, right? So if you go to certain countries, we can even use here as an example, right? When you ask somebody, like, you know, who are you or what are you? They don't identify like, oh, I'm a United States citizen or I'm an American, right? We have all these subdivisions. Oh, I'm African American. Oh, I'm Latinx. I'm this. Oh, I'm so-and-so American. So you have like all these subdivisions of a culture, and you identify with something else first than your actual national identity. And so Cuba understood that because it was a small island, because it was under such an aggression from the United States, this imperial country, it had to really, like, the basis of its survival would be such that they could only survive if they were united, right? Because you were basically closed off from the rest of the world. You had to be able to really collectively, you know, fend for each other, right? So if I had something that you needed, we'd split it down the middle so that we could make sure each of us had it. And so even in the distribution of food and everything else, it was such that everybody had a ration portion of stuff. Everybody's basic needs could be met in that way. And so with that, when it came to the idea of just everybody having access to education, everybody having access to healthcare, everybody having access to something, you know, there were many people who fled, you know, because of the revolution, because they didn't want the redistribution of wealth. They didn't want they didn't want that redistribution of the population who were, you know, once poor, once peasants, now having the same access, right? But those who stayed, you know, this was an opportunity for everybody to kind of like equal out the playing field so that everybody could actually have access. And I think, you know, with that, it allowed for the nation to really see and be a part of something that created this forward movement where society could think of itself in a collective way to really produce the needs of the people and meet the needs of the people.
All right, we're pretty much at time, but if you have time for one more question, I think we have.
I do, but
okay.
I know.
Let's have one more question, and then we'll take a break here. From Fatima, she thanks you for a great presentation. The documentaries are amazing. She wonders which other countries in the world offer scholarships for, if I understand this right, for Cuban students to come to their country to study medicine. What do we know
There's
about
a lot
that?
of collaboration. So many countries, you know, like the Soviet Union, or former Soviet Union, Russia, Germany, I want to say many places in the Caribbean, they allow for that exchange. It's really hard because unfortunately, when you're under a blockade, a system like that, there's so much repercussions that many of the other countries face from the United States for allowing some of that exchange to happen. And because of that, you know, like Cubans can't necessarily go to, you know, embassy and say, oh, you know, can I have a visa? There's like all these different things that you got to do and third world like shenanigans to actually get to a place of doing that. But I think there are some countries that have always been in solidarity with Cuba that have allowed for that exchange to take place. So there's a lot of students that will go to, you know, certain places in Europe. There's a lot of students that will go to places in Africa for education. And these places have been in a place of solidarity with Cuba for so long. So they've allowed some of those exchanges, but sometimes it's still very difficult even with those nations because they'll see so much backlash for that exchange.
Wonderful. Thank you so much for a wonderful presentation, Melissa.
Thank you so much.
I think everyone enjoyed it.